IndiGlobal Media Network.
Thank you very much, everyone. Now the time has come for a very interesting and maybe we'll make it interactive fireside chat and hold back, and soon after that we'll have a very interesting recognition towards our leaders and excellence in education by giving away the awards. So now our special guest with whom we are going to have our fireside chat, she has several credits, awards and accolades to her credit, but we try to encapsulate it in a small video. I would request my team to play the video before we call our guest on the stage.
She is a pioneer in minimal invasive gynecological surgeries. With over 26 years of experience, she is transforming women's healthcare with her expertise in robotic surgery and innovative treatments. She pioneered the art of laparoscopy in the late 90s when laparoscopy was an emerging technology, and it was primarily still a man's world wherein all the techniques and equipment that came out were designed to the ergonomics of the male surgeon. In 2015, she was awarded the Padma Shri, the fourth highest Indian civilian award by the Government of India. That same year, she was also recognized by the Guinness World Records for removing the largest number of uterine fibroids in a single operation. Compassionate care beyond her surgical prowess, Dr. Anagani is known for her compassionate approach to patient care. She understands the unique needs and concerns of women and strives to provide personalized treatment plans that prioritize their well-being. Patient trust Dr. Anagani not only for her expertise but also for the comfort and support she provides throughout the journey. Leadership and advocacy. Dr. Anagani's impact extends far beyond the operating room. As a mentor and educator, she has trained countless surgeons and contributed to the advancement of gynecological care worldwide. With a focus on functional and aesthetic gynecology, she aims to bring about a new revolution in the field, empowering women to live healthier, happier lives. Dr. Anagani, along with the wonderful actor and philanthropist Samantha Ruth Prabhu, has also co-founded an NGO named Pratyusha to campaign for women's health. Let us welcome the Padma Shri Awardee, Dr. Manjula Anagani, a gynecologist, a surgeon, a wellness enthusiast, an artist, an influencer, TEDx speaker, and a friend for the special fireside chat on a very crucial theme: well-being and happiness of educators and students, along with Mr. Sudheer Goutham, the founder, CEO, and editor-in-chief, IndiGlobal Media Network, with a thunderous applause at the IndiGlobal School.
Thank you all for having me here. It's really an honor and privilege to be among the teachers whom we really look up to.
Thank you very much, ma'am, for joining us. And first of all, we have this theme, well-being and happiness of educators and students. Usually, the students, when we look at them, it's all happy and merrier. Do they really have to deal with so many things? Is it really an issue? First of all, we have educators here. They all look good, smiles on their faces. And is it really an issue, is the question. And
I think for that, what I would say is, be truthful and say, is health and well-being being overrated or overshown as very well in the social media, and actually it's the opposite which is happening into the individual. I think in today's time, I've been listening from last two panel discussions and said, everyone wants everything to be rosy, rosy and rosy. That's what we all want to show. We want our school to be the best, we want our teachers to be the best and everything. So what is important is in today's time, the practical aspects of something are something which is being missed in the whole thing. Is it possible for anybody to do, like a woman, if we say, is it possible for me to be a super mom, to a super doctor, to a super wife, to a super daughter-in-law, to a super sister, to super, because I want to be everything. But definitely on Facebook, I'll show that I'm that, this thing, everything. But is it possible? So when you said, I've been listening to everybody, then I said, the epitome, like Mr. Abhilek said, is a child. But I think we are forgetting the two, both who are there. One is educator, one is a student. Why are we sidelining the educator? I think both are equally important for the whole well-being part of it. Otherwise, they both don't go hand in hand and it's never going to be successful. There was a question which Mr. Shrikant Sinha asked about success. Success is only possible only when both the hands come together. Only ek haath se kuch nahi hoga. Tali to bilkul nahi bajegi. So definitely you want to be successful and we need to shake hands. It is both the educator and the child who has to be in the complete total this thing of wellness. So I think we need to understand that and move forward from there.
So that means the educators are
Very important.
Yeah, they're not just educators. We have to look at them as also as a husband, wife, and also a lot many things. Maybe they also have pressure on them to bring numbers.
Social environment is
Social
very important.
environment as well. We do not know about that. So we also saw about you working with a wonderful actress, Samantha. Are you doing something on the direction?
See, education has always been our forte in believing that awareness is the first step for anything. When we talk about medicine, we always talk about prevention is better than cure. That is very easy to say because it's ek sentence to likh de sakte, prevention. But how do anybody know about prevention or how to prevent unless you are aware of the conditions which can come because of some deficiencies or whatever. So awareness comes and when the denial is not there. And for all that, our NGO, when we talk about Pratyusha support, we labeled it as Pratyusha support and not as foundation because we are here to support people. People by themselves are very good in everything. They just don't know. They are like Hanumans. Somebody has to tell, no, you are the best, you can do it. So that little push, especially, I'm sorry, but South Indians especially need that little push. We are not as vocal and as this thing as, I'm not here being a racist or anything, I'm not at all. But we all as such are like, we have that inhibitions that we were never taught by our parents that you have to be vocal, you have to go forward and talk about it. We take things for granted. So first thing is being vocal and talking about it is very important. That's where in our NGO we said we are going to support all the NGOs which are doing their work. And first be spreading the awareness about the health issues. What can happen? There was a question about COVID. Then we said awareness.
Yeah.
Within few days, everybody became COVID doctor. So that was a wrong awareness which they had, unfortunately, till the actual, because that's the way the whole thing came out, including Trump saying you can just take some this thing to drink the antiseptic and the infection will go. To our chief minister telling one paracetamol, the infection will go. So at that particular time, what we think is right is what we say. Only time will say. Science is different, maths is different. Maths definitely, like the paralysis A plus B, whatever, is going to stay. The theorems are here to stay. Whereas in science, what is true today is wrong tomorrow. What is wrong tomorrow again can become right day after. So awareness also keeps changing. Means it's a dynamic equation which should continue. So our first thing in our NGO is to spread awareness. Second thing we talk about is therapy. When it comes to therapy, again, prevention comes very important, like cervical cancer, vaccinations, and all the vaccinations which we have, typhoid and all. So we give a lot of supplementations to HIV. There is an NGO called Desire Society which runs this HIV kits. So for them, the supplementations is given by our NGO. Then next comes the treatment part of it. That's where we again look at giving supplements to all these, this thing. And the kids who need the surgical interventions or hospitalization. And nothing in the world should be free. Anything which comes free is never, ever understood. The value of it is never known, including the health. So I always believe that doctors should become sick one time at least in their life to know the value of a patient.
Yeah.
Not in the form of money. The value of a patient needing the good health, value of the patient waiting for a doctor, the time sense when somebody is sick. The same way, if somebody is sick and the patient is admitted in a hospital, if I say I will waive off the fee, the whole fee I will pay, the patient will never understand the health they get and how to take care of it later on. Yeah. So we have come up with a thing where 1/3 is paid by the patient, 1/3 the hospital who are in this particular program waives off the bill, 1/3 our NGO pays. So that is how we came. We did quite a few cardiac surgeries, to many urological surgeries, to NICU care and all that. So these are all the three main things which we do in our NGO.
Wonderful, ma'am. You also are a mother, and you deal with many things in
Yes.
terms of being a profession as doctor, and other than that as in running an NGO and many things. How are you able to balance things and stay very happy, and what is your mantra you
This
can give
is
out?
the question which many people ask me. I think, like I said, we need to first understand why are we trying to put it in a balance. Balance is the two opposite sides. Why do we have to put everything into opposite sides? Try to keep them in one side. Again, I use the word dynamic. Keep it dynamic. Today, my daughter is my priority. Tomorrow, my profession, my patient is my priority. It keeps changing. So first, the thing in the mind block, that it has to be balanced, that should be removed. Everything should be on one page, not on two different pages where we have to think of balancing. The second thing is, for me, definitely epitome or center is my daughter. So once she's come to first class, till that time तो ज़्यादा फर्क नहीं पड़ेगा, but वहाँ से I started looking around. Okay, I stopped my evening practice. After 5, I do not practice. So by the time she comes to the school, her homework is done. I am there, she is there. Second, I am at a level where my brain works in a different speed. So for me, if my daughter is going to take extra time, like A is for apple, APPLA, I might get irritated and frustrated because my mind, this thing is different. So I definitely believe that I'm not going to be her teacher. I'll be there to play with her, do everything. I don't want the relationships to be strained. So I had a teacher coming home and teaching her what she has, and after that she is with me. So I believe that I'm not born to cook. So I'll have a cook who will cook, I'll have a driver who will drive, but if I need, I can cook, if I need, I can drive. But that is not what I'm made for. So understand what is your process and how things should not be affected by it. Somebody, if I have to rush for an emergency in the morning, 7, I'm not at home, somebody should be seeing that the home is well taken care of. So I think understanding and delegating and giving the leadership qualities to the respective persons will make a huge way. And by the time she came to 10th class, I was always associated with all the corporates. I was with Apollo 4.5, Care 7.5, Yashoda 2.5, Medicover 7 years, and again back to Care right now. But when she's in 10th class, I left all these corporates. And it's not that I'm going to teach her. Like I said, I'm not going to teach her. That will only lead to only a lot of issues between parent-daughter. So I was just there with her. I was only with a nursing home taking care of 3-4 hours of practice only. Once she went into the, I again came back to Medicover thing. Now saying that, then I decided what is she going to do it. When she said undergrad she's going to go to US, then I said how are we going to again make her acclimatize to that. So I put her in Indus where it is weekly boarder. So 5 days she's away from house, she'll get used to it, 2 days home. So I think the strategizing how to get away from homesickness. Then after that she went off and all. So I think everything depends on what we want to do, first point. Then what are all the options we have for getting it done properly. Then what is the best way to do it so that nothing is affected from being the best mom, not necessarily the super mom. So I never had to get away with even my practice or thing. And I believe in success mantra of 6 T's, which works in anything. First is always a technique. Everything has a technique. Teaching is a technique. Nowadays, everything, medicine is a technique. Second is technology. Both go side by side. They're parallel. They have to go. Third is proper training. All of us should be trained properly in what we do. Fourth one is teaching. And very important is teamwork. If the teamwork is not there, nothing can be thing. Finally, our temperament. So I feel that all 6 T's are the basic thing for any success in any field you choose.
Wonderful. So usually the word which goes, how do you strike the balance between your personal life, professional life? So here it's not valid here.
It is definitely not valid for anybody. Today, something else might be your priority. Tomorrow, something else. Why do we have to put it in opposite and say balance, 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 balance?
Great. So how many of you in the audience agree that the majority, especially in the school education, are the leading teachers and the teaching faculty are women? So they are dominating in the school education industry? Okay.
In numbers only.
In numbers, great. So ma'am, what would be your, before I give the opportunity in the audience to ask some questions to you. What would be your mantra or suggestion for them as an educator?
I think 4 things are the more important thing in today's life for everybody to not to go through all these things. The lifestyle diseases have increased. Recent survey said 18% of Indians are having cancers. Forget the diabetic capital, forget the hypertensive capital. We are going to become the cancer capital of the world. So first thing, whatever is happening is the pollution. Second thing is stress. Third is the diet. So these 3 things are things which we have made a thing. Fourth, which is addictions. When I say addictions, alcohol, smoking, drugs, everything which is increasing. Pollution, can we do something? It's something government has to be very, very instrumental in doing it, and each individual person should take it onus on them to how much they can decrease the thing. As a gynecologist, I would like to take this platform and say that, say no to sanitary napkins which has plastics in it. That is the reason why PCOS, endometriosis, and fibroids and endometrial cancers have increased. Okay? So all of you have a daughter or a wife or a sister or you yourself or anybody. Menstrual cups are the best. If not, the organic sanitary napkins. Please say no to sanitary napkins which have a plastics inside it. Plastics nearer to the genital tract will lead to cancers in the genital tract, which is increased tremendously in today's time. That's first. Diet, we have taken all this metabolic syndrome and the complication into our body by westernizing the dietary things. So what is very, very important is decrease carbohydrate, whatever plate, जो भी plate हम लोग लेना है, जो भी खाना है, उसमें just see that there is decreased carbohydrate and increased proteins. I am not going here to tell you, you eat that, you eat this and all, that's your choice. Because without taste, I am one person who will never eat anything which is tasteless, just for the sake of health. It has to be healthy. It has to be tasty. Otherwise, how can you sustain? It is all about sustaining. It's not 1 day, 2 days. But in the plate, see that there is more protein and less carbohydrate. So this is what is important. And third important, as a teacher, I want all of you to tell your students is that exercise is important, but like somebody said, morning 6 se lekar evening 7:30 tak OE exams or IAS, IPS, whatever, and IIT, medicine mein pad rahe, they don't have time for gymming or anything. So what I tell my students who come to us and 13 years, 12 years, 14 years for PT or PCOS is, go into your room, close your doors, take 3 to 4 tapori songs of whichever hero you like and do tapori songs. So 4 dances means every muscle is contracting, means insulin resistance is going to come down. That itself will decrease the metabolic syndrome and the PCOS which is going to be there. The fourth very important is addictions, which I'm sure teachers only should, I really don't know how they deal with, because I get frustrated when my daughter doesn't listen to me, but I have to be very calm about it. I really don't know and appreciate them how they deal with 100 students who act and behave erratically, and it's a very challenging situation. So peer pressures are real, and I know of many kids who come, parents come, and they are also so shit scared of their children when they talk in front of me. Because the girls just look at them, if anything the mother says, madam, she's not listening, madam, she's not dancing, and the girl will just look at the mother like this. So it's not that she doesn't have to say something. So with that sort of a thing, teenage, anything we want to say it as teenage tantrums, we'll say hormonal thing happening in this age group. So this is the reality which we have to understand, but we need to go around it. So I feel telling them not to eat McDonald's is not going to help. Tell them to eat chicken in that than this, saying that chicken from Kentucky and not the thing, or let me, I'm using the thing, but I don't know. We really don't know. They're all cultivated. Cultivated, see, for a businessman, is the money which makes sense. They have to make sense. Means a chicken should weigh more than so much kgs so that they make more money. Means they're going to inject it with whatever anabolic steroids so that it can become heavier. We need to understand that. I have seen days and months baby having gynecomastia, means breast development and bleeding PV. Because, and the mother says, no madam, we don't feed anything. The cow will come near our house, then only in front of our eyes. I know, but cow is coming here, but where, what is it given at home? We don't know. The estrogens given or whatever they give, oxytocin they give there for more milk to come, will secrete the hormones. These hormones are going to go into the baby and feed. So I tell them, please just give pasteurized milk. It doesn't matter what you're giving. Getting a cow here or a buffalo here doesn't make any sense if you really do not know what it is going to be fed at their home. And these are few things which we need to understand, that Some things we cannot change, but things we can change, modifiable things, are what we should look at, especially in the environmental changes and the dietary changes.
Wonderful. I hope there are some good takeaways. If there are some questions in the audience, one or two.
Hi Manjula ma'am, I mean we're knowing each other for long, and so it's such a delight to see you right now. And what you said was, every bit of it I think was so practical, more than just the theory. And I thought that was the most important thing. So my question is, so what's your mantra for success?
I told you just like that. No, one thing, I tell everybody that only, do what you want to do. Again, here I'll take my daughter into it and then just tell you. Everybody keeps asking me, your daughter is not a doctor, because they have seen her from right this age along with him. I said, no. What will you do with your legacy? I said, so many of my students are there who come and learn. I said, what legacy are you talking about, especially in healthcare? It is not something where you can say can have acquired ability. There should be innate and acquired ability for anybody to be successful. So in healthcare, where we are dealing with lives, you cannot wait for a long latent period for them to acquire ability and start experimenting on the human being. So in 9th class, my daughter came back and said, I don't think I want to be a doctor. I said, okay, fine. That time I was in Yashoda. So I sent her to a 1-week doctor's course where she went to all the 5 days, and I called up my friends and said, she's coming. See that she'll be interested. After 1 week, she came and said, I don't think I'm made to be a doctor. I will not be a doctor. I said, okay, fine, don't be. Then she never took this, but still in interest, she said, let me also take bio. So MP, BC is what she took. But at the end of it, she said, Mom, I don't want to be. I said, no problem. But before doing that, she came back and asked me one question. Do we have to study 11 years to be a doctor? I said, I didn't want to dissing her. I didn't want to tell, even today I study. So it's not like, it's a lifelong study. So I said, minimum 11 years. She said, no way I'm going to study like that. No. I said, okay, don't do it. So that's how it started off. Then she went to University of San Francisco to do computer science engineering. Today's generation definitely knows what not to do. They really don't know what they want to do, but they know what they don't want to do. So she went there, and then within a week she says, I don't think I'm made to do computer science sitting like that and all. I'm going to change my subject. I said, okay. So she changed it into economics. One semester, somehow she finished, she said. And she said, no, I don't like economics. I don't want to do that. So finally, she can only change 3 times. So she was stuck with finance, and she finished with finance. Then COVID came. Then she came to Hyderabad. Then luckily for me, IIIT, she did the robotic and machine learning for 6 months. Knowing people, it was, she could do it. And then she said, I think now I'm finding. She said, I'm going to take data science in my master's. I said, okay, do it. And then she said, she warned me before only, she said, this might be my second best thing. First best, still I don't know. I said, okay, fine. But she she finished from Babson's in data science. And right now, from last 1.5 years, she's working as a data scientist. Luckily for her, I say, because she chose what she wanted to do, where everything was like, jobs were lost, people were losing. She had 3 job offers by the time she finished her master's. She had one from Florida, one from California, the regular place which she didn't want to go, one from Boston. So she's doing in Boston, and she's doing well. Her friends did not get the jobs, and there are people who are still doing OPTs and coming back. So I think if they do what they want to do, is what is the thing we should be looking at. That is the mantra for success, what they want to do.
Thank you very much, ma'am, for your wonderful time. Before we wind up, a huge round of applause for our special guest.
Thank you all for having me here.
And madam would also be doing the honors to our awardees here. A small token of appreciation from the IndiGlobal Media Network. And
IndiGlobal Media Network, taking innovation, collaboration and growth to the forefront.